Hello, family and friends of Therapeutic Links. My name is Julie Bergen, and I am here today to talk about our segment of Ask an OT. And today's session will be all about modifying Halloween. Especially now, we're not too sure what's going to be happening with this celebration. However, we are here to help give strategies and modifications to make this the best and most enjoyable Halloween that everyone can have. So the very first topic is the dreaded costume. Many parents come to us and ask, how do I adapt these costumes because my child absolutely hates them? The first thing to really remember is let your child be creative. Take out the norm that they have to be the superhero or the witch or anything like that. Let your child spark their imagination and wear whatever they want to wear and let them give the title for who they are. That is the best part about Halloween. We're all able to be unique and just to use our imagination. However, if your child does want to be a superhero or a witch or those kind of things, and those store-bought costumes are very, very tricky to wear. The big thing with those is usually they're oversized, there's lots of tags in them, and they don't fit quite right. And with that light touch, that could be very, very difficult for kids with tactile sensitivities. So one thing to think about is try to find the costume or related colors with pajamas. Pajamas are usually tighter fitting. It's a more consistent pressure for the body, which helps with grounding and just organizing. And then they can layer stuff on top if you'd like. So the costumes are not fun. The other thing is masks. Masks are usually not fun for kids with sensory difficulties as well because it could block their vision, which could be their strongest asset. And so again, let your child be the one to pick those things out and find things that they want to be. They don't necessarily have to be that standard witch. They can be whatever they want to be. Hone into their creativity and enjoy it. The very next question we get is, what do I do if my child can't say trick or treat? And that's definitely a big topic. There are some people that when they're giving away their treats, they're expecting that trick or treat. I'm hoping nowadays with education out there that not everyone has that language to say it. So what I encourage all families to do is bring whatever form of communication your child is using. Bring a visual. Laminate it and have trick or treat on one side and thank you on the other. Or bring any augmentative devices, their iPads or things like that can help. And then practice these. Practice them inside your home. Practice them with friends and families and practice it out in the community. This gives them the opportunity to kind of understand what Halloween is and what kind of language they can use. Again, there's lots of other tools that we can use, and if you are struggling with some of the communication aspect of things, please don't hesitate to contact our friends at Pediatric Interactions, and they are the great speech therapists that can also give you more supports and techniques for this opportunity for communication. And lastly, we get the question, what is Halloween going to look like this year? Although I am dressed as a witch, unfortunately, I can't predict the future. We do know, however, that Halloween is going to look very different this year. One thing to maybe plan for if trick-or-treating is not available in your area is have a virtual party. Wear your costumes, call up your family and friends, and just enjoy being together online. You can do many different things, such as a dance party or carving pumpkins together, even virtually. Or what you can do is invite over a close gathering of family and friends to your house. You can have an outdoor scavenger hunt. You can even, again, carve pumpkins, do a dance party, or maybe just some of you watch some spooky Halloween movies together. And you can wear your costume for the whole entire day. If trick-or-treating is available, this is a great opportunity to think about and have recognition of those people that have food allergies. Instead of giving treats that are edible, look at things such as pencils or stickers, those kind of things that we don't have to worry about them putting in their mouths. Another thing is make sure that your treats are individually wrapped and put it in the trick-or-treaters' bags versus them reaching in and grabbing it. Again, Halloween may look very, very different this year, but we do know it's still a great time to have fun, maybe just a little differently. And hopefully, fingers crossed, we can really enjoy, considering last year it snowed on Halloween. We hope you enjoyed this segment of Ask an OT. And for further detailed information, please check out our other social media pages, such as Instagram and Facebook. And we'll go more into depth in the topics that I discussed today. As occupational therapists, definitely trick-or-treating is an occupation that we can help support everyone to participate in. We hope you guys have a great and healthy and happy Halloween. Thank you.